That was a long walk and just thinking about how I'm going to convince you guys to say no. All right, so cholecystectomy actually is supposed to be after 9 days, so not 8 days. So I have a few disclosures. My first disclosure, consulted for Intuitive. Second disclosure, it's really true. I've been watching a lot of movies, how to convince a jury, how to kind of change their thoughts. So can I see a show of hands of how many of you are attendings? Keep your hands up if you take calls. Okay, that's easy. This is too easy. All right, so you have no friends in the right upper quadrant, and we're students for life. How many of us had a gallbladder that was an elective gallbladder and we walked in and it was something from hell? Okay, exactly, right? Okay, and what's different today than where we were 3 years ago? We all have masks on, right? You're in an airplane, you have to have a mask on because we're dealing with something called COVID, and we're all familiar with it too well. All right, so let's go over the scenario again, okay? The question is, should I perform a cholecystectomy on this case? We're not just talking about any cholecystectomy. Why are we talking about gallbladder? Why is this important? Why is Sage bringing this up? Because the most common problem that you're gonna get, or that page that you're gonna get in the middle of the night from your chief resident or from the hospital is that, hey, I have a consult, a patient has right upper quadrant pain, and for some reason they always decide to come after midnight, okay? So this patient is 56, he had the symptoms 9 days ago or 8 days ago, it doesn't make a difference, okay? And his pain is just not getting better. I don't know why he decides to come in 8 days later versus the same day, but it's something that he can live with, right? And he has no jaundice, no icterus, and his past medical history, look at it. You know, hypertension, arthritis. I don't have hypertension, but my knees hurt, okay? I mean, we all have arthritis. He's not diabetic, okay? So his BMI is 38, heart rate is normal, blood pressure is okay. The only abnormal thing in his lab is his white count is 14, okay? So should I perform a cholecystectomy? I honestly think you shouldn't, okay? No one is questioning your skills, whether it can be performed or not. Yes, there are robots, we can do this case laparoscopically. Some people, it can be done. But the question, should it be done on this case that's presented? All right, and again, I think you shouldn't be doing this case. And here's the reason why. If you put on PubMed, all right, acute cholecystitis, all right, you'll have 175 results. If you add the word COVID to that search, it will come down to 11 results. And most of those studies are coming from countries outside of the US because our system, let's be honest, our system, the access to the health system is much easier than Europe, than UK, than Turkey, than other countries, okay? All right, let's look at this curve here, okay? This is COVID in 2020, all right? The vaccination came around this time here. Okay, like late 2021, or in the beginning of 2021. This is where we were, okay, when people went this is after the vaccination happened. We had higher numbers of COVID. We had cancellations, elective cases are being canceled because patients are testing positive for COVID. To be honest with you, in our hospital to a point, we stopped testing people that were vaccinated, So, I mean, it is a real problem. It's not going anytime soon. All right, so at the end of the day, we have to do no harm. So I see a few gray hairs and some people that don't have hairs at all. Probably they're also older. But the thing is that back in the days when you had an acute gallbladder, you did not treat them immediately, right? We gave them some antibiotics, they went home, and you brought them back later, okay? So can you treat patients with antibiotics? Yes. This was actually a study from Thailand, and they showed that as long as we give them antibiotics and we treat them within 100 days, okay, which is the 3 months that's mentioned in our scenario. Again, I want you just to focus on our scenario, okay? These patients will do okay as long as, and that's 3 months. 3 months is 90 days. It's less than 100 days. All right, so can it be done? It can be done. All right, so let's look at the factors that we need to consider whether we should operate on this patient or not. There are patient factors, physician factors, and hospital factors. What are the patient factors? Again, we're all physicians, do no harm. This patient is not septic that's presented to us, okay? He's not your old diabetic patient. He has no fever. He has no tachycardia. He was celebrating with his kids, okay? And he has this right upper quadrant pain that he's been sleeping on for 9 days, all right? He never failed conservative treatment or diet modification, eat less pizza, celebrate with your kids, eat less pizza, all right? We never gave him antibiotic. Give him some time to take off of work, have him arrange his home affairs. If this was like around the holidays, people travel to kind of see their in-laws, whether they like it or not. They travel to see their in-laws, they travel to see family, have them have the surgery at their own state, all right? Patients believe in what we tell them. If you tell them you need surgery, they're gonna okay, all right, fine, I'll sign up. But was this patient offered to conservative treatment and antibiotics? No. So what are the physician factors that we're looking at, okay? We all have elective cases. We all have clinics. You get called middle of the night, you have a gallbladder, okay, or this patient comes to the ER. In your clinic, are you admitting this patient immediately? Not really. We have our clinic operative days. Why disrupt your day? And again, the most important thing, do no harm. Having to be on the add-on list, it is painful, especially if you work in a hospital that deals with trauma. You get bumped with a trauma. It is very, very painful. So why do that, come on. We also have our lives outside of the hospital. We do our best to take care of our patients. So what are the hospital factors? COVID, again, is not going anywhere soon. At some point in my hospital in Detroit, if you tested positive for COVID, as long as you have no symptoms, you come back to the hospital, okay? You have no symptoms for 24 hours, you come back to the hospital. So we have no manpower, okay? Nurses are leaving the hospital because they're getting paid more as a travel agency. Scrub tech, the same thing, is getting more as a travel agent. We're backed up from 2020. We have patients who are scheduled for elective cases are testing positive for COVID with cancer. We have to delay their surgery, so we're really being backed up. So again, should you? Yes, you can. You guys can do this case. You guys can do it with your eyes closed, probably. But the question is that, should it be done? And I think the answer should be no. Thank you.